Welcome all of you to Sukoon Unlimited. Today we are a little delayed, but okay, we'll extend beyond our time given the circumstance today. Today we have Dr. Narsimhaya Sri Nivasaya from Apollo Hospitals. Um, Dr. Narsimhaya is specializes in colorectal surgery. He's a sphincter saving surgery in his special interest and expertise. He uses both laparoscopy and robotic surgery and brings experience and expertise from the UK, USA, Germany, and Lisbon. He provides complete, comprehensive bowel care with cancer services, the core, colonoscopy, diagnostic, minimally invasive surgery, all undertaken. So, welcome, sir. Honored to have you here. Without any further delay today, I'll just share the PPT on the screen.
Lovely, madam. Ladies and gentlemen, a warm good evening to one and all. As I said, I'm very sorry, unreserved apology because it just got missed out with another schedule and I missed out on the time.
क्योंकि आप लोग ज्यादा कुछ खाते नहीं इसलिए हम ज्यादा लाए नहीं
So,
बजट है
let's talk about living longer. So, let me think to ourselves who doesn't want to live longer? We all want to live longer. But is there a secret to it? What's the philosophy behind it? What is the science behind it? Of course, people are all working to see whether we can live longer. Money is being spent, research is being done, and people are really making strides in living longer. Is there a magic medication? Or is there something else that we should do to live longer? Let us explore more. Next slide, please. So, what I say to people is even before we start thinking about living longer, aging, we all age, we all ripe. And actually, we ripe, we age, becoming more wiser, more wittier, and of course, comes with the aging is joy, pleasure, and pain too. When we say, is age a bane or is it really a boon? We always think it's probably a bane. But when the reality is, it's actually a boon when you get to the elderly age, when you get to the ripe age. If you look at your parents, if you look at your cousins, uncles, aunts who are actually living that ripe age, you see, wow, they have lived a good life. That's what we tend to say. But what is the bane that comes with aging is something we have to explore. And is there a way we can prolong this living is something we have to think about. Next slide, please. So, before we start thinking about living longer, we should start thinking about health. If we are healthy, if we are well, if we are arogya mein sahi hai to I think we'll all live longer. But how can we make this wellness to continue for long rather than becoming ill? I think this is the place where the interaction between the nature, nurture, and the mind exists. And it is very simple. I think the solutions to live longer exists in the nature, the way we nurture ourselves, and of course, the mind, the influence of which we have underestimated. Next slide, please. So, if you move on to the interaction of the nature, nurture, and the mind, this is what it is. Majority of the times, it is in the mother nature, the genetic influences, the biology of the nature, the environment we are in, of course, how we tame ourselves, the influence of exercise, the influence of eating, the influence of obesity, nurturing ourselves so that we don't smoke, we don't drink too much, etc. So, nurturing plays a very important role. And of course, we haven't explored much into the role of mind or the cognitive and the non cognitive state of minds in this process of aging. Next slide, please. So, I think this interaction is very important. And if I start breaking it down to nature and nurture, look around us. If you start looking around us, we start seeing air pollution, water pollution, food contamination, industrial pollution. Of course, not to ignore the stress that we are into in this era of civilizational poverty. All of this bring contamination, bring changes, bring health related issues, non communicable diseases, etc. If you actually go back to what the Egyptians said to us, they said a very, very apt statement, which is very apt even for today. We think we are in a state of deficiency. No, we are in a state of excess. We eat more, we drink more, we actually enjoy too much. That is the problem. A quarter of what you eat keeps you alive, three quarters of it keeps your doctor alive. So much true to today. I think we need to live a life of minimalism. We need to live a life of, just enough rather than accumulating things. So, less food, reasonable amount of water, less stress, less fat on yourself, etc. So I think this interaction between the nature and the nurture truly exists. How pollution can impact on your health and the way we are is truly something to explore. Next slide, please. So, moving on from the state of natural influences and nurturing, the role of the mind has to be taken into account. And this is what the WHO organization talks about. What's health? If I want to know what is not being healthy, let us start thinking about what is health. World Health Organization defines health with an example or with a definition to say it's a state of physical, mental, and psychosocial well being. And it is just not absence of any disease. Who says this? In fact, this was derived from Desmond Freud's work, working for 20 to 30 years on social science about health. Let us go back to our own Ayurveda. What is the definition of health in Ayurveda? Okay, Sama Veda, Sama Agni, Sama Dhatu, Mala Karyaha, Prasanna Atma Indriya Mana, says Charaka Samhita. Look at how meaningful it is. Sama dosha, sama agni, sama dhatu. So you need a balance in your physical organs and systems. The physical forces that you go through. And also you need that balance in the physiological functioning that we are going through. What is important that the stress is mala karyaha. So the function of evacuation. So good toileting is very, very vital for your good health. Prasanna, happy, is the Atma, the soul, Indriya, the sensations, and Mana, the inside. So I think so aptly said, going back to our Ayurveda, what health is. And we should aim to keep all of this in functioning to attain a good health and thereby good health leading to longevity or living longer. Next slide, please. So moving on from the definition of health from the World Health Organization perspective, we are looking at what is stopping us from living longer. What is stopping us from not being well? It is the non communicable diseases. So, ladies and gentlemen, we are fighting a big problem arising out of non communicable diseases. The amount of money spent on the diseases and the death caused by non communicable diseases is almost 60% of your expenses or the economy of the country. That is how much money we are spending on the mortality and the morbidity that is coming out of the non communicable diseases. So, what are non communicable diseases? Let us peep into it. Non communicable diseases are those diseases that are not contagious. Those are diseases of lifestyle. Those are diseases of affluence. And India is a country of spiritual richness. Let us take the example of Gautami. Gautami was a disciple of Mahavira. When Gautami lost her son, she took the little one to Mahavira and said, "Oh, my Lord, please bring my child back to life." And Mahavira, in a sense, says, "Please go and fetch me a mustard seed from a house that has not seen death, and I will bring your little one back to life." That is what Mahavira said. Gautami went from home to home, went from village to village, town to town, and eventually to get enlightened and come back realizing that death is a true reality of every family. And that's how common NCDs are today, ladies and gentlemen. Show me one household without diabetes, hypertension, stroke, and cancers in the near and far relatives. Very difficult to find. I think the crux of living longer, the crux of the problem lies in the non communicable diseases and the lifestyle to a greater extent. Next slide, please. So I think amongst the whole lot of non communicable diseases, the one which we worry about, the one which we fear about is, of course, cancer. And cancer is something that is projected as a beast, but it is truly not a beast. And it is something I would like to enforce on and at least enlighten and tell you what I know about cancer as a part of cancer journey and give you some tips on prevention and living longer. Next slide, please. So, I think when we start talking about the cancer journey, it is important to know what is the extent of the problem. If you do not know where we come from, how do you know where to go? So, if you look at it, about 2 crore population per year are diagnosed with cancer worldwide. 2 crore people. So that's a lot of people diagnosed with new cancers every year. So that is the extent of the problem we have. Next slide, please. So I think cancers are truly increasing. The reason being, multiple. Why are cancers increasing? Multiple reasons. And I think how can we prevent them? If you can take one slide from me today, ladies and gentlemen, it is this slide. I think we have moved on from simplistic, stress free, organic life to a stressful, filled with, pollution, both physical pollution as well as pollution to your minds, to an urban setting. And I think NCDs are a pure problem of the urban setting where we are looking at diabetes, hypertension, cancers, and strokes staring at us. And I think the essence is, can you go back to the simple life you led, both physically and psychosocially, is the thought process. Next slide, please. I think prevention is important, but let us see what we can do to prevent. Before that, let us see how much of a problem it is causing. We're all living longer. I think that is one of the reasons that we are seeing cancers today, more cancers. Why are we seeing more of it? Because we are living longer. Let me take you back to 1935. The average lifespan was only 35. And let me show you later how much we are living longer today. And of course, we have better diagnostics, better treatment. People are aware. And such sessions, for example, that is run by Sukun today, is actually an awareness session to tell people and make them aware of what the problem is. And of course, affordability has got better, both from the effort of the government as well as the policymakers, and at a personal level, the population is becoming more affordable. And of course, the government is helping with the insurance, and we're also starting to identify the risk factors from the nature, the nurturing, and the mind. So I think that is the reason we are seeing a lot more cancers now, leading on to more deaths from cancer and more problems from cancer, so to say. And I think the key of the cure lies in prevention and awareness, ladies and gentlemen. Next slide, please. So I think understanding the presence of the disease and understanding the extent or quantity of the disease, we need to understand what the cancer journey looks like. And I think if you look at this slide, majority of the patients we see today unfortunately fall into the lower pathway, into a palliative pathway, because of lack of awareness, because of failure to attend to a clinician much earlier on. But once we understand and know, if we go through the right treatment pathway and an early cancer picked up leads on to cure, thereby surviving and living longer. And the key is to be aware that cancers can be picked up early, symptoms can be an indicator to pick up the cancers early and go on to live longer having cured them. So that is what we talk about, the cancer journey. So I want to give you a little exercise, ladies and gentlemen. I want to give you a little exercise. An exercise for your minds, an exercise for your psychology. I truly want you to close your eyes and I want you to start taking deep breaths in, concentrating on your breathing pattern. A deep breath in, feeling the air gushing through your nostrils to the back of your throat, to your lungs, and feeling that lungs open up and breathing out. I want you to start doing this very rhythmically, very peacefully, trying to experience that nectar of life, oxygen gushing through your lungs, thereby oxygenating the blood. When you're breathing, you start feeling your heartbeat, a lub and a dub, a lub and a dub. You start experiencing the breaths and the heart rate. When you're doing this, a thought comes to your mind, a message pings you on your phone. Your near and dear one has been diagnosed with cancer or has been suspected to have cancer. Your heart starts to race. Your breath starts to go faster. There are thoughts in your mind running, and the thoughts vary from deep emotions to a total blankness or darkness. And if you verbalize these emotions, ladies and gentlemen, you can open your eyes now. These are some of the emotions people feel. People have a sense of fear, a sense of pain, fear of knowing not much about what is going on, the feeling of the disease being ugly, the feeling that it's a battle you may lose, and the fear of death. But is it true? Probably not, and we'll see why. Next slide, please. So I think if you start going forward from the fear of cancer impacting on one's family, if you look back to the history, this is what Hippocrates described. This is what our Ayurveda talked about. This is what our Sanskrit talked about. Karkata, Karkata is cancer. Karkata is crab claws. Karkata is, meaning, the feeling that the cancer invades the organs. And of course, we have made a huge stride, when it comes to cancer research and treatments. Next slide, please. From what started as an historical Karkata, today we are talking about precision based therapies. We are talking about robotics. We are talking about immunotherapies. I informed you all that cancer is actually not a disease. Cancer is a stage of one's evolution. Cancer is a stage in one's life. And if you compare the cancer to an old banyan tree, it is quite natural for the stems, for the branches to rot. You just cut them and move on so that the tree lives to go on, lives to sustain on. Look at the graph on the left hand side. I want to take you back to 1935 when the average lifespan of an Indian was 35 years only. Today, the average lifespan is about 70 years, 70 years, and it is going to go up. So we're actually living longer. Better diagnostics, better treatment strategies, low maternal mortalities, of course, no war crimes. So, all of these things have made us live longer. Today, on an average in India, we live about 70 years. But is it the same everywhere in India? Of course not. You go to Kashmir, your average lifespan is about 83. You go to Bihar, it's about 55. You come to Karnataka, it's about 70. The national average is 70. So I think what has to be reinforced to one and all, ladies and gentlemen, is cancer is not a disease, but in the bulk majority, cancer is a stage of evolution. Next slide, please. So, informing you that it is only a stage of one's life, we start looking at cancer into a bit more depth and detail, ladies and gentlemen. Next slide, please. So, this is the molecular basis of cancer. What is the molecular basis? For those people who are less aware of biology, it's a simplistic thing. Body is an amazing organ, amazing creation of the mother nature. We have multiple organs. These organs talk to each other, interact with each other. And of course, these organs have cells. And these cells die and are reborn, die and are reborn. For example, the blood cells stay for about 90 days and a new cell is born. So what creates a new cell is the motherboard. The within the cell there is a nucleus, and that nucleus has the data material that gets transferred, and a new cell is born with the same data material. When this data material of ATGC, the nucleic acids, change, a bad cell is born. Next slide, please. I think the problem is the bad cell. The bad cell can be born because of aging. The bad cells can be born because of smoking, red meat, irradiation. So lots of things can cause a bad cell to be born. When a bad cell is born, the body is so clever that it kills off the bad cell by a scientific process called as apoptosis. Apoptosis is programmed cell death. So the analogy I give to people is you have a nice lawn in your garden. There's a small weed that comes out. You take the weed and throw it, the lawn is clean and clear. If you miss out to clear the weed from the weed takes over and the lawn is gone. That is how simple cancers are. A bad cell is born, the body kills the bad cell. Next slide, please. If you do not kill the bad cells grow, the bad cells grow and they become a lump, and this lump, which has got no organization, is growing very fast, very disorganized, and is very hungry. This lump is called as cancer. Nothing more than this, nothing less than this. And every cell in the body has got the potential to become a cancer. If it's in the gut, we call it bowel cancer. If it's in the breast, we call it as breast cancer. If it is in the brain, we call it brain cancer, etc. So I think what we have to realize and understand, ladies and gentlemen, is cancer is nothing but a lump of bad cells which have grown together and have formed a lump. Next slide, please. So, moving on from the molecular basis of cancer, see, every cell in the body has the capacity to become a cancer. Next slide, please. So, moving on from cancer, we start talking about risk factors. This is what causes cancers early. So, when somebody follows a very high risk life or is into practices that are hazardous or are nurturing them in a bad way, cancers can come early. Smoking causes lung cancers and oral cancers, tongue cancers. Bangalore is called as the breast cancer capital of India. Why? Because people smoke, people drink, people are career driven. There is nothing wrong to be career driven. But what impacts is delayed marriages, oral contraceptive pills, no children, no breastfeeding. All of this can cause breast cancers. Having excessive red meat, saturated fried food can cause bowel cancers. The most important risk factor above all is obesity. Obesity can cause every cancer known to mankind, and that's the worst of the whole risk factors we talk about. Next slide, please. So, when we talk about the risk factors, this is where nurturing comes to play, and I think we need to try and control the risk factors. And what has the government got to do? I think if you look at the constitution, if you look at the policymakers, there is a right to life. Article 20 gives you the right to life, which means the policymakers have to give you fresh air, good water, and food that is not contaminated. But you should question yourself whether you're getting all three. At least in Bangalore, we don't have breathable air. Potable water is not available, and we have to rely on bottled water. And the food that is sourced, we do not know whether it's organic or where it is sourced from. Something to think about. So, are we really fulfilling our fundamental rights? Is a question. And if you look at history of cancer, there is so much to talk about, and cancers have been there from times immemorial, and it has been talked about from the times of the World War when it comes to treatments. Next slide, please. So the history is there, and people have progressed in terms of the treatments for cancer. Next slide, please. And when we talk about somebody being diagnosed with cancer, we know that history has also told us about chemotherapies from the World War. Next slide, please. So this is a touch on the history of cancer. And now moving on, how do you diagnose cancers? Okay, doctor, here we are talking about symptoms. How do I find out cancer at an early stage? How do I get a hint that there is a problem? When do I go to a doctor? This is the question every one of us feels or experiences, or question ourselves or question our doctors. That is where symptoms come into play, ladies and gentlemen. So, now what is a symptom? Even before we go to diagnosis, we need to understand what is a symptom. Symptom is a manifestation, a complaint which is not normal to oneself, which cannot be explained by a reason, and which has been there for 4 to 6 weeks. That is a symptom. Let me give you an example. Women folk have menstrual cycles. They stop at about 50 or 55. And if somebody starts to bleed after they have stopped their periods, that's a symptom. And if they do that for 4 to 6 weeks, and there is no reason to explain that, then it becomes a symptom. Somebody has got cough, which is not settling down, and now they started coughing blood too. That is a symptom. Somebody goes to the toilet once a day, but suddenly they start going about 4 to 5 times a day, and now they've also got blood in the stools. That's a symptom. Blood in the urine, blood in the stools, blood when you're coughing, vomiting blood, weight loss, losing blood, anemia. All these are symptoms. When somebody gets a symptom, the first thing we need to do is go to a sensible doctor who can talk to you, who can understand what the problem is and guide you through. But what do, ladies and gentlemen? We Google it. We seek the help of the internet. We start self diagnosing, which causes two problems. One, you start getting worried. You're a well person, but you start getting worried and you become a worried well. And two, that confusion leads on to significant anxiety and restlessness, and you start going to labs and scanning centers to get scans done. This is what internet does. So the bottom line is, when you're faced with a symptom, you please go and see a doctor so that the doctor can separate the gold from the dust. He can talk to you, order the right tests, do the right examinations, and if necessary, take a biopsy and confirm that there are too many abnormal cells which are causing cancer. If you actually look at it, why are symptoms important? Ladies and gentlemen, if there are 100,000 people who are asymptomatic and you check them, you find about 5 to 7 cancers. However, if you pick up only 100 people with symptoms, you pick up about 4 to 6 cancers. So I think it is important to be aware of the symptoms. If there are symptoms, you need to go and see a doctor, and then the doctor examines you after a history, does some tests such as a ultrasound, CT, or an endoscopy. If there is a problem, he'll do biopsies or he'll get the biopsy done. Then we move on to the next stage of what we call as grading and staging. Grading is checking whether the cancer is a good or a bad or an ugly cancer. Staging is to tell whether it is just there or has moved forward or moved far. Stage one, it is there where it is born. Stage four is it has gone far. So that is important that we do. And the most difficult bit is the decision making process and then the treatment, so to say. Next slide, please. So when it comes to diagnosis, it has to be driven by clinical examination, investigations, and then when we diagnose, we said there's a good cancer, there's a bad cancer, and there's an ugly cancer. Mind you, ladies and gentlemen, not all cancers are bad. There are good cancers too. It's like multiple prisoners in a jail, and not all of them are bad, and some of them have come down for petty problems, and they can be rectified and sent back. Likewise, good cancers are easy to manage, ugly cancers are difficult to manage, something which is very important for us for management. Next slide, please. Moving on from grading, we move on to staging. So, what is staging? Staging is a process which tells us whether the cancer is just there where it is born, stage one, is big where it is born, stage two, has given some seeds around where it is born, stage three, and stage four, it has gone far from where it is born. Stage 1, 2, easily curable. Stage 3 needs some chemotherapy, radiotherapy before we cure them. And stage 4, it is about managing the symptoms and prolonging the survival. That is how stage 1, 2, 3, and 4 are managed. But these days, even stage 4 cancers, some of them can be treated with immunotherapy, thereby giving cure. So cancers are not the same as they were before. We have multiple magic bullets now to treat them. Next slide, please. So moving on from staging, the most difficult bit we face is the decision making. How do we decide what the right treatment for this patient is? One is 40, one is 80. Both have the same cancer. Do you treat both of them the same way? Something to think about. So I think the most difficult thing we see is decision making, for which we use a tumor board. We use about 10 or 12 people sit together and discuss your case to recommend what is best for you so that there is no conflict of interest, ladies and gentlemen. Next slide, please. I think we are living in a world which is much smaller and globalized now, and I think it is easy to reach out to get a reasonable decision, a good decision, so to say. Next slide, please. But at the crux of it all, is the decision making. We have to check the patient factors. We have to check what the evidence is. We have to check what the affordability is. We have to check where you're living. And of course, patient choice is very important, which has to be taken into consideration. Next slide, please. So, the most difficult thing in the decision making process is the decision making process. So, this tells us there is no one size fits all. If you look at it here, ladies and gentlemen, you have got cancers of the bowel there, cancers of the breast there. You've got an elderly gentleman who's in his 80s or ripe 80s. I was giving you an example of a 40-year-old with a small cancer and an 80-year-old with a small cancer. If they're both in an area where you evacuate, where you go to the toilet or the back passage, what is the treatment you give to both of them? Would you treat both of them the same way or would you treat them differently? Let me put it this way, ladies and gentlemen. There is no one size fits all, and it is horses for courses. I cannot treat the 80-year-old the same way as I would treat a 40-year-old. The reason is, I just mentioned to you, the average lifespan is about 70, and the gentleman who's 80 is on the bonus period. However, if I operate on the 80-year-old and if I follow him up for 1 year, 1 in 3 people die in the first month, the second one dies in the next 11 months. So I have actually harmed two people by operating on him because he's elderly. He doesn't die of the cancer, he dies of heart attack, he dies of stroke, he dies of other causes. However, for the 40-year-old, I need to do an operation because he's still got 30 years ahead to live. So I think it is no one size fits all. And sometimes doing nothing is the best treatment, or giving a touch of radiotherapy and let these three people live who are above 80 for another 2 3 years. So that's how decision making becomes very very important, and the heart of decision making lies in the tumor board or the cancer board, which we utilize in all the hospitals. Next slide, please. Moving on from decision making, we are now reaching what we call as the power of the mind. Mind is the strongest power you can have, something called as psychoneuroimmunology. If you actually look at people who have gone through cancer, some die. Parikar died from Goa. Some survive. Yuvraj Singh, he fought through cancer and he's a winner. Anant Kumar died. So cancers, unfortunately, don't spare the royals, don't spare the commoners, don't spare the celebrities, don't spare the sportsmen. It spares nobody. But what it does is, ladies and gentlemen, it puts people into three categories. One, fighters, one, winners or survivors, and one, losers. And the differentiating point is the one who survived had a strong mental capacity. He thought, I can cure this. He thought, I can fight it. She thought, I can do it. So, a positive thinking is very important. The one who said, I'm done, I'm finished, they give up. So the important thing is to be mentally strong. Psychoneuroimmunology. Thalamus is strong. Pituitary is strong. Thymus is strong. Gives you T cells which can fight the cancer. So very important for you all to be mentally very, very strong. Next slide, please. So I think the mind has surely a fantastic, role to play where we are working on treating cancer just with a positive mindset. And then comes the treatment. This is the easier bit, ladies and gentlemen. Technology has moved on. Time and tide waits for none, goes the say. But now we say time, tide, and tumor waits for none, but technology cannot wait for any. So technology is here to stay. We can do robotic operations, we can do laparoscopic operations. So people can give stratified, precision based oncotherapy, immunotherapy. So I think there are so much on the offer that there is a lot of cure for a lot of cancers we talk about, even stage 4 cancers. And in the unfortunate event that they have a bad cancer and is stage 4, it is our duty, it is our job to give them a better quality of life, to give them a pain free life, and give them the right to die in a dignified way. And that is good palliation. Next slide, please. So I think the treatment of cancers vary from cures to good palliation, ladies and gentlemen. Next slide, please. So I think it is important they understand that palliation should be optimal and should be done to the best when patients are in their stage 4 and have got a bad cancer. Next slide, please. So I think moving on, next slide, please. Next slide, please. Moving on from, can somebody move the slide, please?
Yeah, is the screen still visible?
No, madam, it's gone to C. The screen is
Okay,
not
okay, my
visible, I think. Yeah.
sure, sure. Sharing it again.
That's okay. So what we are trying to get to here is how we can, make things better when it comes to cancer care. So there is so much about chemotherapy, hormonal therapy, and immunotherapy these days. Immunotherapy for lung, immunotherapy for kidneys can actually melt away the cancers. Lymphomas melt away just with medications. So that is what the progress that we have made with oncotherapies. Next slide, please. So I think decisions are more difficult than incisions, and that is what we struggle when it comes to cancer care, ladies and gentlemen. See, my job is not done just by operating and sending you home. My job starts there where I check after you, where I look after you every year on year for the next 5 years by clinical examinations, cancer markers, and some scans for the next 5 years. We doctors become a part of your life. We become patient advocates, and we will become your partners for the next 5 years or so. The gist of the process is you pick up an early cancer because you picked up an early symptom, you're cured. In the unfortunate event you don't pick up and you land up with a late stage, the chances that we can give cure starts to go down. Next slide, please. This is what this next slide shows about. If you pick up early cancers, you've done very well. If you don't pick up early cancers, you'll end up losing patients. Next slide, please. So I think the key thing is to be aware of the symptoms, seek timely help, reach the right people. Next slide, please. Make the right decisions. And actually, once we have done that, you will go on to live much longer in a better way. So far, ladies and gentlemen, I spoke to you about what is health. I spoke to you about what is being not well. I spoke to you about non communicable diseases. I spoke to you about cancers. I spoke to you about what cancers can do. I spoke to you about the cancer journey. And I spoke to you about what can be done when there is cancer. But more important, and the most important, is prevention. How do you prevent cancers? Is there something that can prevent cancers? Is there something that can make me healthy? Is there something that can make me live longer? Ladies and gentlemen, there is a secret here. The secret is your gut. Gut is a forgotten organ. Gut is an organ which we think is only meant for eating and evacuating. Unfortunately, we have got it wrong. There are about 40 trillion bacteria in our gut. A happy gut leads to happy health and a long life. I don't want to go through all the details, so much so to say, you're feeling happy, you've got a good gut. You're not feeling happy, you've got a bad gut with bad bugs. Okay? Even cancers come from bad guts, bad bugs in your guts. Digestion is a problem if there are bad bugs. So I think it is important that you look after your gut. More importantly, prevent inflammation in your gut. What goes in dictates how bad the gut can be, both food and bacteria. So I think gut has a very important role to play. And let's talk a bit about the gut as a part of prevention of all the diseases and ailments we see. Next slide, please. So the gut, as I told you, it's about 6 to 7 meters and has got about 13 trillion bacteria. But look at this. It's a fantastic slide to say your gut is at threat. Surely, I think truly what problems we see today with non-communicable diseases, diabetes, hypertension, obesity, heart attacks, strokes, and cancers are surely related to the diet and the changes in the diet we are going through. Next slide, please. So I think this threat to the gut too should be averted, and the aversion of the threat to the gut lies in our hands, ladies and gentlemen. So what goes in is what dictates what we are. And I think, we need to look after our gut, and not only the gut dictates how your body behaves and your mind behaves. So it's essentially a gut brain axis we are talking about today. Next slide, please. So I think gut is an organ which has been forgotten, which is very vital for our survival, and we need to look after the gut and prevent all the diseases. This is what we have to do. What's an Indian plate with all of that food doing out there? It is telling us we have gone a step too far in westernization. It's telling us our culture, our habits, our nuances that we had was the best thing. Look at that palate. with the food, a long acting carbohydrates, roti, a short acting carbohydrate, rice, the protein, the lentil, the vada, the protein, the paisam, the sweet, the yogurt, the probiotic, the milk that comes with some amount of fat, the ghee, the required fat, the pickle which has got the prawn, the prebiotic, the right amount of salt, this rasam, the appetizer. So, this is what a balanced meal was. And that is what used to keep our gut healthy. Today, I think that doesn't exist in the general population to a great extent. We live on Zomatos, we live on Swiggies, we live on once a day cooked meal, and the rest of it is warmed meal. The culture of sitting as a family and eating is gone. It did a lot of good for the physiology. The gut got going, the juices started flowing, the laughter helped you to digest the food, and it was a psychological comfort. That is not there anymore. Role of fasting, the telomere effect. This won a Nobel Prize a few years ago. So if you fast, the speed with which you age comes down, which means you stay younger. True to say. Our ancestors did it, Amavasya, moonless nights. Once or twice in a month, we used to do all of those things. But today, we call it by fancy names such as 18-hour fasting, intermittent fasting, etc. Of course, exercise can prevent and reduce the cancer risk, and some medications can. Next slide, please. But the best therapy is also the laughter, which we have forgotten. Spending time with your loved ones, which we have forgotten. Yoga and meditation, which we have forgotten. And using antioxidant diets rich in antioxidants such as nuts and fruits, etc. But what we have forgotten, ladies and gentlemen, is a simple thing: evacuation, toileting. As important as eating is evacuating as well. I told you in the beginning what health meant amongst the Ayurveda, amongst the Charaka Sushruta. We called as, the Malakaryaha, Sama dosha, Sama Agni, Sama Dhatu, Malakaryaha. Prasanna, Atma, Indriya, Mana. So I think very important that we have emphasized not now, centuries ago, about toileting, and a clean gut will lead to a clean health. Something we have to think about. And let me talk a bit more on toileting. Next slide, please. So I think if you look back at the history of toileting, ladies and gentlemen, it has changed. Next slide, please. We were always utilizing the toilet and the ground, whether you went to the Romans or before. I think the toilets were on the ground. Next slide, please. As times changed, from moving on from the Romans to the further civilizations, we started improvising. We thought, moving on from the Indian toilets on the ground, we went on to Western toilets. Next slide, please. So change came in. When the change came in, toileting changed. Next slide, please. When the toileting changed, problems started happening. The moment we started sitting, next slide please, the gut got blocked. The outlet was closed, the toilet was closed, and we were evacuating against a closed gate, thereby causing bloating, pain, discomfort, feeling of incomplete evacuation, damage to the bowel, hemorrhoids, inflammation, fissures, and of course, cancers. So, all of this came from Western toilets, sitting on a Western toilet. Next slide, please. The solution to all of that lies in squatting, which is using a squatty potty or an Indian toilet. So, ladies and gentlemen, what I've emphasized now is about the gut, the importance of good food, exercise, sleep, laughter, and more importantly, not using a Western toilet. And if you're compelled to use a Western toilet, using a squatty potty is what I have reinforced you. And of course, when we treat patients, quality assurance is important, looking after them is important, and doing the right job is important. Next slide, please. So I think as clinicians, it is our job not only to do things, but also to propagate what we do to the future generations, utilize the technology, use the knowledge and the skill, and provide the best care we can for our patients for the greater good of the humanity. Next slide, please. So I think knowledge and technology is important, dissemination of knowledge is important, so that the future generations can learn from what we have learned, and we have to disseminate this. And this is what education and translation of knowledge is. Next slide, please. So I think, practically speaking, it is not too bad. You can take a deep breath, breathe out, and look at that slide. There is a lot of hope. There's cure. There is life after cancer. There is courage that people get after cancer. They are more stronger, and there is peace at mind. And people go on to live happily ever after. Speak to those people who have had cancer therapy and have been survivors. They will tell you how to lead a life. Next slide, please. So I think it's not as bad as we thought initially. And I think the key thing is for us to not only cure, but also prevent. And prevention lies in awareness, seeking advice, decreasing the risk factors at a population level. As a professional and with people like Sukun, this is what we are doing today, creating that awareness, screening early, diagnosing and treating. And at the government level, they have a lot to do, the policymakers, reduce pollution, plastics, pesticides, tobacco, obesity agents, and of course, implement screening programs. Next slide, please. So I think prevention is important, ladies and gentlemen, but let us start doing what we preach. Let us be the change that you wish to see, and let us be the Vivekananda, where he said, arise, awake, stop not till the goal is reached. And that is what we need to work on. And let us not forget the roots where we came from, the mother nature where we belong to, and the civilization has actually made us more poorer. And let us start getting back to the simplistic way of life. Next slide, please. And let us all aim to look after the nature and leave this nature a better place for the future generations, nurture ourselves well so that we can go on to live longer and utilize the power of the brain. And as I said, ladies and gentlemen, the most difficult thing in life is about decision making. And I leave you with this thought and some piece of work I did on decision making in surgery and cancer care. I'm very grateful. Thank you for your time, and I'm more than happy to take any questions. And apologies again for I couldn't be on time. Thank you, one and all. Happy for questions to be taken.
So we have the first comment here by Deepak sir. Deepak sir has written, why not to give comparative study about how to keep fit by living with nature, adopting naturopathy and other methodology, and explain it in a scientific way by some organizations, and doctors can give the best comparative. Healthypedia, like
This
Wikipedia.
this is already started. If you look at something called as blue zones, blue zones are areas that are popular in some parts of US, Japan, where these are secluded geographical areas where they're exactly doing this. Good air, good food, good exercise, meditation, and people are living longer into their hundreds. Exactly the same what our colleague is talking about. Stress free, disease free, happy life. And that is what they're trying to do in the blue zones. And the investments for these are coming from all corners, including people like Elon Musk, who are investing in blue zones to see what is the impact it is doing on aging. So, an absolutely phenomenal thought. It needs vision and it needs somebody to implement.
Thank you, doctor. Next, we have question from Mr. Umesh. He says, can we have a list of symptoms of early cancer? Mostly we are not aware and
I'll be
informed.
I'll be absolutely delighted to provide a PDF of the same. I will connect with Nigel, our liaison from corporate, and I can pass it on to Sukun. Not a problem at all.
Sure, sure. I'll connect with Nigel. No problem.
Nigel, and in fact, I have a website called as Bangalore Bowel Care. Or even you can jot down my number and ping a message directly. I don't have a problem. I will put it on the on the chat box. My number. Somebody can jot it down if they want to. But I will send it as a PDF to you, madam, and you can disseminate it. It's not a problem.
Sure, 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 sure. Okay. Next, I think we don't have any questions. Everybody is thanking you for a wonderful session, sir.
Thank
Any
you,
more
madam.
questions from anyone? Please feel free to ask now. Okay, Sangeeta ma'am has. Sangeeta ma'am, please go ahead.
So, thank you very much for most enlightening talk. So much awareness has been created. But, sir, this thing about squatting, it's a knee problem, you know. Squatting at this age becomes a problem for that.
Agreed, madam. Agreed. So let me put it this way, madam. Okay. Which one came first is the question. See, I we have seen our grandparents easily using the Indian toilet and squatting on the ground. Why did the knee problems come in? Because of lack of mobility. And the problem is our Western toilets, lack of mobility has actually brought on stiffness in the knees. Obesity has brought on difficulty to sit down and squat. So, obesity, arthritis is what is causing people not to squat. Okay. One is because we have not trained them. Suppose you truly cannot squat, not a problem. That is where we have squatty potties. Squatty potty is the second best alternative that will do a great job. And if you actually really want to know more, go to social media and type in the art of toileting and put my name on, and you'll get some videos on the benefits of toileting and how we can improve on the squatting. So, squatting can be done, not that we cannot do it, but in the event that we can't do it because we have not been training, we have not done it for a while, a squatty potty is the second best option. I hope that answers your question, madam.
Thank you very much.
Uh,
Any other
good-
question?
yeah.
Okay, Umesh sir has. Please go ahead, sir.
Good evening, doctor, for a wonderful presentation that you made. It was really an eye opener to all of us.
Thank you, Manish.
Uh, uh, we really wonder most of the things we don't know, and we end up into problem, as madam said. And you reply to it that what comes first, the cause or the symptoms. Uh, I will be thankful if you can share me the list of that symptoms that you have rightly said to share to us. I just while talking to you, understanding you, you made a wonderful remark on blue zone. Is
Yeah,
it correct? I
correct,
remember
sir.
correct.
Correct, sir. Correct, sir.
If you can, it is. I heard for the first time, and I don't know how many of us in India understands and knows about it. If you can little elaborate on this, what is this blue zone about, and what do they do there exactly? I would like to know and a little work on it.
Lovely, sir. So, sir, think about it. Okay. People who are reasonably rich, affluent, and healthy, or affluent and healthy, who want to live longer, like minded people who wanted to live longer, adapt a healthy lifestyle, went into areas, where the weather, the environment was good. They got, so essentially taking the nature was good. They nurtured themselves well. So a lot of changes such as total plant-based diet, for example, not eating meat, not eating too much of oil, not eating animal products. So totally plant-based diet, good exercise, lot of laughter, good socio-economic interactions, and of course taking care of the risk factors and health problems, and living in that secluded group or area with continuous monitoring is what is called as a blue zone. You just Google blue zone, it will come. India, they're trying to pull up a one or two around Himalayas, and a lot of small groups are working, but there are multiple of them, some of them in US predominantly, and a lot of them in Japan, and now some of the European countries are bringing up. And these are blue zones where people want to live longer, and they're trying to show living 100 years is not a difficult thing. So that is essentially the gist of a blue zone, sir. I hope that answers your question. Otherwise, you write to me, I'll send you all the links for the blue zones, sir.
Right, sir. Thank you very much.
Lovely, Umesh Saab. Lovely, Umesh Saab.
Okay. Any other question that we have? Um, Sangeeta ma'am has one more. Please go ahead, ma'am.
One more question. Is the development of gas after eating regularly and incomplete evacuation, what is the reason for that? Could that be a symptom of cancer?
No, madam. An absolutely relevant question, so to say, something I see often in my routine practice. So, there is a connect between the brain, the bowel, the gut, and the back passage. Okay. Any of the above get into trouble, you'll end up in trouble. So, your predominant symptom is bloating. Think about it, your gate is not opening properly. When your gate is not opening properly, that is called as obstructive defecation or evacuatory dysfunction. The gas stacks up, pressure builds up, stool stays inside, you get bloating, you get abdominal swelling or bloating, difficulty evacuation, feeling of incomplete evacuation, toilet not happening properly. Even if it happens like a small stick, bit by bit by bit. So the problem could be the gate, one. The problem could be the gut. When you eat food rich in sugar, aloo, shakkar, rice, all of these things produce a lot of gas. These are called as diets rich in producing gas, and these are diets rich in high FODMAP. So these are diets which can ferment very quickly when they go to the gut. When they ferment very quickly with the bacteria, they give you energy, gas, and water. And this gives you bloating. So the second problem could be the high FODMAP diet you're on. The third problem could be what we call as bacterial dysbiosis. What that means is that there is a mismatch, there is a lack of balance between the good and the bad bacteria in your gut, predominantly driven by abuse of antibiotics, abuse of your gut, processed food. All of these things can cause disruption of the balance that we have in the bacteria, and this is called as dysbiosis. So these are the few reasons why you might be having bloating: evacuatory dysfunction, pelvic floor problem, dietary problems, or dysbiosis. I can give some medications to deal with the effect. You give some simethicone, some charcoal, your gas is gone with some probiotics. But that doesn't help in the long run. You need to correct the cause. If it is a pelvic floor problem, correct it. Exercise, change in the toileting, etc. If it is the diet, change it. If it is dysbiosis, correct the bacteria. So I think it needs a specialist like me or somebody else who deal with this to see, figure out what is going on, rule out cancer, colitis, etc., and do what is required. I hope that answers your question, madam.
Yeah, so I use the adult suppository Dulcoflex. That eases the thing. So is regular use of that not advisable?
No, no. See, madam, I think you're only dealing with the effect. अभी क्या कर रहे हैं, आपको बुखार है, डोलो ले लेते हैं, बुखार क्यों आया कोई पूछता नहीं ना. So that is the most important thing. Why are you getting this? Is that because you have a lot of laxity? Is that you're not opening the gate? Is that you're eating too many fermentable foods? Or is it the bacterial disproportion? So you need to see a clinician who can separate the gold from the dust, figure out what the root cause problem is, and then treat according to it. Taking suppository doesn't harm you, but that doesn't solve the problem. That only relieves the problem temporarily. I hope that answers your question, madam.
Yes, sir. Thank you very much.
Lovely, madam. Lovely, lovely.
One more question from my side, sir. Adding on Sangeeta's ma'am issues, my wife also has got lots of bloating, and to the extent I have noticed when you do some massaging on the lymphatic areas, the bloating comes are much more vigorously, more frequently, and she feel relieved. So I'm just trying to understand the treatment. I have not used any medicine so far. Yes, we have switched to our food habits, like more of a sprouts, more of that fruits.
No, no,
Uh,
sir, I'll tell you. Can also produce more gas. Okay.
oh,
Some fruits can produce more gas, but I'll tell you what the problem may be. See,
mm,
even stress, for example, can cause pelvic floor spasm, and they cannot empty the back passage easily. They cannot
mm,
empty the urine, or they feel incomplete even after emptying the urine. So I think it's very easy. We need to work on the brain by relaxation techniques. If there is stress, deal with it. If there is anxiety, deal with it. If there is OCD, deal with it. Deal with the bowel. Bowel could be dealing with the food products, dealing with the bacteria, dealing with the spasms, whatever. Then dealing with the gait. Dealing with the gait could involve, relaxation techniques using Indian toilet, malasana, pranayama, setubandhasana, doing pelvic floor exercises, Kegels exercises, if need be, treating with some Botox to the pelvic floor. So that is to do with the gait. So you need to deal with the gait, you need to deal with the gut, you need to deal with the gyre or the brain. In the process, we can also use pharmacological therapy, we can use psychotherapy, but there are no operations for this. When people say, oh, IBS hai, IBS is something that has to be derived after you rule out everything. And that is where my specialty lies as well. I deal with cancers, colitis, IBS, IBD, etc. But it needs a clinician who can sit down and spend time with you to understand what the problem is and provide solution to the problem.
okay. But do you have, like, we are in Delhi? We are in Delhi.
Sir, you can have a virtual consult and we can do reasonably okay on that. Though we will miss out on the physical examination, on a virtual consult, we can do something about it, sir. Not a problem.
Thank you very much. Thanks a lot.
Lovely, sir. Lovely, sir.
Thank you so much, everyone. I think we are coming towards the end of our session today. First of all, thank you so much for having patience for the initial glitches that we have. Um, Thank you so much, Doctor. We are honored to have you here. Thank you so much for taking out time for our Sukoon community members.
Thank you and all. And I hope you have forgiven me. Apologies again for the delay.
No, no, sir. Thank you so much. Thank you so much for your time today. Thank you very much.
Thanks a lot.
Lovely
Thank you.
session.
Lovely, sir.
Thank
Thank
you.
you, doctor.
Thank
Thank
you.
you, doctor.
Thank you.
Thank you, doctor.